It is actually the same topic as the other ones. And that is voice ergonomics work in Sweden, what we have done and what is the need. And I do not have an acoustician in this group from our state, so my presentation here will be very much from my clinical background. As I told you yesterday, I work as a speech language pathologist, seeing many of these patients with voice problems related to the occupation, but I also cooperate with engineers at the Royal Institute of Technology. So I have divided my talk here into two parts, what has been done in Sweden and what is needed in occupational research and in our clinical work. So I start with the research, and I would like to name an important person for this part of the work, and that's Björn Fritzl, who had a deep interest in the field of voice problems and occupations. And during the 1970s, he inspired many of my colleagues and students at that time to study prevalence of voice disorders in different occupational groups. And he also started a national study to obtain statistics among patients at the phoniatric departments in Sweden. And this is what he found, and that is now a quite old reference from 1996, but it was found that teachers were the largest group of patients among our patients, and 76% were women. We talked about this a little bit yesterday, and maybe that was not clear enough. And the most common diagnosis, phonosthenia, that is a functional voice disorder, vocal fold edema, vocal fold polyp, and vocal fold nodules. All these were, majority were women having this. And now I'm happy that this study is repeated in Lund in Sweden, and so we can get new data, because there are other professional groups coming into our working force, but so far it seems to be quite the same results. And why is this? Also to mention that there are gender differences in voice production and gender differences in vocal fold pathology, and we think that it's related to the women have shorter vocal folds, which means a higher frequency and more vocal fold collisions when speaking. We have a shorter vocal tract, that's the resonant tube from the vocal folds to the lips, which makes us having a lighter voice quality and a weaker voice. And there is less degree of hyaluronic acid in the vocal folds in females, so which means that it's not as good dampening of the vocal folds. So all these, together with that many females work in vocally demanding occupations, seem to that women are more vulnerable to voice problems. We have another important background here is that Ann-Kristin Olsson, a colleague of mine from in the 80s, started with research about voice and work environment towards an ecology of vocal behavior, and she used at that time a voice accumulator to try to measure voice use, and she measured that for different professions like telephone operators, nurses, speech pathologists, and welders. She was out in the Volvo factories to measure how the welders use their voice in a very, very high background noise level. So the current research areas in our country is that we still work on long-term measurements of voice with focus on voice production in high background activity noise, and that is the research group I belong to in Stockholm. And then in Lund there are teacher voice and room acoustics focus on that research, and then it's a group in Gothenburg working with preventive voice care in teachers. And just to tell you a little bit about a voice accumulator that you can use, and we have done this a long time ago to measure the voice use in occupational and non-occupational settings. And this was used for 12 vocally healthy preschool teachers, and what you could measure at this time was fundamental frequency and phonation time. And we could see that the average fundamental frequency, which is the voice pitch, during and after voice for healthy preschool teachers. You can see for all of them had a higher fundamental frequency or higher voice pitch when they worked as compared to after work when they lowered their voice pitch. And the same was with the phonation time. They spoke, the vocal folds were more active during work as compared to leisure time, except for one person here. And similar results were actually found recently in America. Of 55 teachers' voice use, it was Hunter and Tietze who studied this, compared voice use during occupation and after. And this is very important data that we are now getting because of the new equipments. For example, to have, when we discuss if a voice disorder should be classified as a work disease, we have to have some documentation then, and these kind of measurements are very valuable. I worked for a long time with female voice in preschool teacher settings, and the background was a little bit similar as we heard yesterday from England, that during the 70s, many large daycare centers, you were talking about schools, but in Sweden we had a very boom of new daycare centers, and they were built. And they were followed by acousticians and architects, how that would turn out. So they actually had quite a good numbers when it came to reverberation time and noise levels. But then they continued to work, and during the 80s the noise levels had increased very, very much, and then they did interventions and actually reduced the noise levels about 10 dB in average by changing architecture, changing the acoustics, and also changing the pedagogical strategies. So during the 80s it was much better in our country, and then during the 90s it was like a very big change, larger groups of children, and the increase of noise level increased, and there were several studies showing that between 70 and 80 dB in general were common. And I think the situation is even worse now, because we have very much now new free schools, as we call it. You can start a school or you can start a preschool, and very many of them go into use rooms and buildings that were not supposed to be for educational reasons from the beginning, and I think that's a huge problem right now. At this time we used simultaneous measures of background noise and voice, and this was that recording, and we could at that time, because we have always been interested to record the noise and the voice at the same time to see how they interfere with each other. And this was also used by Anita McAllister for children voice use. And we found very high background noise levels, and that the voice intensity for the teachers, preschool teachers, were much higher during the voice, the working, than when they were using the voice in habitual reading, and the same was found for fundamental frequency. So conclusions from several studies were that preschool teachers have very vocally demanding work, and the background activity noise, I set background/activity noise here because we have only measured in the, while activity has been going on, and that's probably a combination of the two, found to be a risk factor. And we also, from this data, found that the importance of field studies, that you actually go out and measure on site, and that has also been proposed by Lena Rantala many years ago. This method was very time-consuming and problematic, but I would like to just mention, because I think this was an important study by Anita McAllister, that they looked at the noise levels at the ears of the children who wore the equipment, and of course they were much lower, closer to the floor, where a lot of activity noise were caused, when they slashed the toys in the floor and so on. And you could see here that at the level of the children's ears, the noise was as much at between 80 and 85 dB, and this was found for 3 preschools. So when we compared, or Anita compared actually, the noise levels from our study, that we found like 76% in average, they were much higher from the children's side. So I think this is a very, very important message that we shouldn't just look for the children. It's a totally other story, actually, and there are data to support this from these kind of studies. I mentioned this study a little bit yesterday, the vocal loading and background noise at different work environments, through laboratory studies that we have done, and we have also included voice. We grasped and used work environment sounds. This is from a daycare center, and it was a realistic sound level of 76 dB. And we asked the people to talk in this noise. And you heard from yesterday that we also asked people to talk in the loud disco noise and noise from industries. So we had 12 women and 11 men doing this, and they also talked in a quiet environment. And they also had to rate how they felt. Did you make yourself heard? Was your speech or voice effortful? And did you feel vocal fatigue or strain? And this was just a very short loading test, just for 1.5 minutes. So they were sitting on in a studio, and they had the noise and the sound from two loudspeakers behind them. We recorded the voice and the noise, and we could, or the engineers could, separate the voice from the noise. And I will show you this again, even if most of you heard this, just to listen what happened to the voice when the noise is away. So you could hear that she really pressed her voice a lot to make herself heard. We did a lot of analysis of the voice, and we're very happy that it was possible acoustically to separate the voice from the voice. So among the results, we found that the male voices were 3 to 5 dB louder throughout. The females were, of course, higher in pitch, that we knew already, but they were we found data on that. The females felt more strain during the reading, and they felt that they had to exert their voice even more, and the males were more confident in that they were having been heard. So these results supported the notion that females are more vulnerable to vocal overload in noisy environments. Now I'm working on a current project, and we try this in the same theme to identify risk factors for voice disorders, and the background noise is actually one of the main issues. And we have here a collaboration with Kerstin Weijer Persson at Gothenburg University and Lund University, Linköping University with Anita McAllister, Sten Ternström at Royal Institute of Technology, and Fredrik Lindström in Umeå. And he has actually developed a portable voice accumulator called Voxlog, and it's a little like a head necklace with an accelerometer in one side that picks up the pressure changes from the vocal folds, so you can measure the fundamental frequency and phonation time, and on the other one is a microphone that can measure the level of the speaking voice and the level of the background noise. So since you have the detection of the speech, the equipment can decide when the speaker is speaking and when it's not noise just from the environment. So this is some of the questions we ask now. Now, is the vocal behavior affected by the level of the background activity noise? And so far it seems that people have very different strategies how they do when they speak, and some have very good strategies and others really try to overuse the noise. And questions we have also, does vocally loading measured with accumulated cycle loops correlate with subjective symptoms of vocal fatigue? There are some earlier studies by Lena Rantala that there are some connection with that, but we need much more information of that. And are there differences in voice use in occupational and non-occupational settings? And we also wonder what are the differences between patients and vocally healthy controls. So we have now in a process to gather data from 30 patients with work-related voice disorders and 30 vocally healthy controls, and they are matched as regards gender and workplace. So they wore this equipment simultaneously during 1 week, and they go through a lot of prior voice assessment. And we do the voice ergonomic assessment following the checklist presented by Eva Sala yesterday, and we do the long-term field registration 1 to 2 weeks using the Vox log from morning to night and during work and leisure. And the subjects also have, of course, to write a diary so that we can, after, identify different activities. So they also rate vocal fatigue and hoarseness 4 times a day. And then this is the analysis we get from the Vox log, and we have by hand identify where is work and where is after work. And then very easily we get some average numbers of this. So this is the fundamental frequency, this is the level of the background noise and level of the speaker's voice, and this is the phonation time. So the data collection is ongoing, and we have so far just published one in Swedish, one pilot study, but this is something that I think we can get a lot of information out of. The other research group is working on the teacher's voice and room acoustics in schools, and I think this is very, very interesting. The prevalence of voice disorders in teachers seem to be 13%. I talked about this yesterday. And Vivica Lyberg-Olander presented her doctoral thesis a year ago. And she worked actually together with an acoustician and who actually tested in a laboratory setting and simulated different classroom acoustics, the room size, the reverberation time, and then the speakers also told how they felt to speak in different environments. And the results were that the room that supported the voice, the more comfortable the speaker was. And that was important, that the reverberation time should not be too short. Usually you say it should be short, but it should, for speakers from a frequency point of view, it should not be too short. But it's not specified exactly how much it is, but it's worth thinking. And they also measure the reverberation time, room gain, and activity noise in 30 real classrooms. And the results were that the teacher's voice intensity were mostly affected by the activity noise. So we have the importance of activity noise. But the teachers with weak voices and voice problems were more dependent on the room acoustics. So I think this is also a very important message. And there are several publications by David Pellegrin Garcia and Vivica Lyberg-Olander in this issue. And this is from the Preventive Voice Care group in teachers in Gothenburg. And actually she's following now 1,200 students and give them randomized voice care treatment, preventive voice training. And she will follow them some years from now. I think there will be some logistic problems because they move. They are difficult to find. They're very busy. Teacher students are very busy. They do the practice in different places and so on. But I think the way she has planned it is very good, and it's supported also by one of the state research councils. And there's one publication here, prevalence of voice symptoms in teacher students. That is the first, and then the intervention will be given. I will mention now a few things that we have been working on with the Swedish Work Environment Authority. They were going to change or renew, revise their, what you call, this is related to the law, but it is the, could we say statement or standard? And when they were going to do that, we, from our group, we said that, well, can you please include something about disturbing noise and speech and voice? And we had a very fruitful discussion. So when this was published again, 2005, this is in Swedish now, but it is really one paragraph saying that if the background noise, the activity noise is very high, some people will have a hard time to speak in that, and especially in school and preschool environments, and women are especially may have a high risk to get voice problems, and it can have problems with the vocal fold apparatus and make damage to that. So I think, in the law and in the registration here, I think we have a lot of information that we can use. Also related to when this came, the Swedish Work Environment Authority had a campaign, a national campaign. It said, get rid of the voice. A good noise environment is effective. And they actually inspected more than 700 preschools. They went out there, they did measurements of the acoustics and also the background noise levels. And I don't remember, but it was more than 30% of them, or more, that had to change, that got a remark that they were not good enough. But this also is a very good information in Swedish. Now it's quite a few years. But what came out was that the preschool teachers were so creative also themselves to think about things that could change and increase or improve the work environment. And also in this, it really states that disturbing noise can be, influence the voice and the speech. So I think at least in Sweden we have the work authorities are now very, they know about this. So, and I will tell you a little bit of the voice ergonomic knowledge review that actually the work environment asked us to do. This is actually, they have to bring about new information from different fields. And 2009, they commissioned, the Swedish Work Environment Authority commissioned a research survey from Karolinska Institute. And this is in Swedish, and it's a research review. It was actually supported economically by the Swedish Work Environment Authority. We had a reference group by Eva Sala, Stellan Hertegård, Susanna Simberg, and Sten Ternström, and it was published last year. And I'm very happy because this is, if you see the other ones, they are like operating costs, threats and violence, living chemicals, safety culture, deaths, ergonomics, and so there are a number of different parts of the work environment that has been focused on, and we are here now, voice ergonomics. So for me, this has been a very, very important publication. It is in Swedish, and the target groups are those. And we picked up to focus on teachers, call center personnel, and artists because they are well known in our population, in the voice clinics, and so on. And we focused on these, the work environmental factors. So the research that's related to these aspects are covered in this. And we went through all these kind of different studies, and the goal to spread knowledge, improve work environment, and provide basis for intervention and education, and prevent occupational voice disorders. And it's actually used as a textbook in Swedish. We use it now for the speech pathology program, for example. I will now say something about the clinical work. It's always, we know a lot from research. It's always a challenge to get it into the clinic and work and follow what the research data tells us to do. And of course, education is maybe the most important. And we have different target groups, colleagues, and that I've been working with a lot, students, SLP students, but also the chiefs and other professions. We have had specialized courses in occupational voice disorders and voice ergonomics arranged by Karolinska Institute 2007, 2011, and at Lund 2012. And we focus both on theory but also on the practice, the laboratory activities to know about amplification, as we heard yesterday, test to speak in high background noise, do voice ergonomic assessments, and use the Vox log or APM. we try to update our colleagues by short courses as well, and we have a national network of speech-language pathologists who are specially interested and specialized in voice ergonomics. We teach the students, they get quite a lot of lectures about occupational voice and voice ergonomics now. We have programs at 6 cities in Sweden for the moment. And actually they are, during their education, encouraged to at least go and visit one patient at their workplace, because that's such an eye-opener to see how that works as related to when you see the patient in the therapy room. This is a very important group, chief speech pathologists, that are actually directing the kind of work that speech-language pathologists should do. So this we have to also keep in mind. This is a lot of other people who also need to know about this area, and this is where we haven't done so far. We have worked with the Swedish Work Environment Authority, yes, and the inspectors from SWEA, but there are a lot more for us to do here. And also, I think, in the clinical work, we can do much more of this measurement, long-term measurements of work, because now there are 2 available, commercially available equipments, and that is the ambulatory phonation monitor developed in the United States, and the Voxlog that I told you about. And they are quite similar. The ambulatory phonation monitor has, you have to glue a little, accelerometer on the throat, and it's still quite large, and you actually have to calibrate it every day for the same person, and then you can get an estimate of the voice intensity. It doesn't measure the voice level, level of the background noise, and that might be very good, because then you really focus on the speaker. And as I said before, this is the Voxlog with the ability to also measure the level of the background noise, and also it's very handy. You don't have to calibrate it every time, so that you can put it, the subject take it home and charge it as a telephone, and then put it on the next morning, so you can actually get data from many more days at a time. So the conclusions both from when we were working with this research review or knowledge review, that there are evidence that environmental factors can cause voice disorders, and that the work environmental law shall be used much more, and the employers need to be involved. This is now how it looks in Sweden and has been done for quite a long time. The patient and the healthcare takes care of the problem. The employer doesn't do anything. And this is what we have to do in the future, because the employer do have a lot of responsibility for the work environment. And voice ergonomics assessment should be part of the systematic work environment screening at workplaces, especially when a functional voice is necessary for the work outcome. And development of methods and routines are needed, and the checklist is a very good start. There's a material we can use, but we have to decide who is going to do it, and we do not have that structure in Sweden. So still we do not know who is going to use it, and so on. Statistics, this is also what we need to do. Statistics is missing in Sweden about the costs for society for the occupational voice disorders, and this information should be gathered. Criteria, and we talked about a little bit yesterday, and norms for how much a voice can be loaded are needed to avoid voice disorders. But there's a lot of more research that we have to do before we can discuss or try to set some kind of norms or legislations around that. We also need criteria for decisions about voice disorders as work disease. That needs to be developed. And the education need is large, and the preventive voice education is needed in programs educating persons to vocally demanding occupations, and that we have also talked about. I would like to finish, because I am not sharing your Valdis exactly. You said that the occupational safety and health does not include the voice. But when we have been working with the experts at the Swedish Work Environment Authority, they say, well, you have to use the law, because it's quite open, it's quite wide. So if we of course not if it comes to legislation. I mean that doesn't cover the activity noise, but they're very open about disturbing noise. And this is, I think, if we read a little bit from the Swedish Work Environment Act and think from a work or voice ergonomic perspective, that the working conditions shall be adapted to people's different physical and mental aptitudes. So if you have a weak voice, actually this should be done. Work shall be planned and arranged in such a way as to provide a suitable working environment. You can use that when you discuss if you're going to change something in the work environment. The employee shall be given the opportunity of participating in design of his own working situation. Working premises shall be arranged and equipped in such a way as to provide a suitable working environment. And personal protective equipment shall be used, and I'm thinking of a voice amplification system, for example, when adequate security from ill health and accidents cannot be achieved by other means. This equipment should be provided by the employer. So I think, and what I am teaching now my students and my colleagues is, well, look at the law, see what's in there and use the information, and I think we can use it much more than we do today. So that would be my message, and thank you very much.